Thank you for that notification. We're being recorded, everybody. But the way that pedestrian travel and multimodal travel has been increasingly salient in that organization, I believe is due to the excellent leadership here. So I'm excited to hear your talk today. Glad to work with you and hope for many more sessions like this. I turn it over to you.
All right. Thank you so much, Carrie. That was humbling to hear. I'm going to start sharing my screen so that everybody can see the presentation slides. And let me know if this does not come up. And I'm going to go to slideshow on current slide. Okay, so I've got the slideshow up. So again, thank you, Carrie. Thanks, Sam, for making me a part of this webinar series. And thanks everybody for joining this afternoon. I think we've got a really important topic to talk about, and I want to make sure to cover what I'm going to cover, hopefully in about minutes, and give us a little bit of chance for discussion near the end. This topic we were originally supposed to have in mid-March, and a lot happened in mid-March. And in fact, a lot of things have happened since then in terms of a pandemic, in terms of our greater cultural awareness of systemic racism and issues related to that. So as I present and talk about mode shift theory and how we could increase walking and biking, I'd like you to keep those things in the back of your mind too, because they may generate some questions for the end. How do these new developments, at least in our consciousness, get reflected in how we do our work? So I want to start a little bit with how this connects to health-oriented transportation in the webinar series. I really just love the themes out of this. We want to encourage walking and biking. How do we make these more accessible and desirable? How can we actually change our environment, the built environment, to allow these choices to be more attractive? That's what the heart of this is at. I want to start with a little story about my visit to Copenhagen a couple of years ago. I went there in January, and this picture was taken when I was walking down the street and looking and enjoying the city, even though it was snowing. I met this woman who was on her bicycle, and as I was waiting there at the stoplight and she was there too, I looked into that carrying container, and inside it was a child about 2 years old just playing on an iPad. Just any old day, it's snowing outside, in a bicycle and just on an iPad, nothing to it. And I asked her, can I take your picture? Is that okay? And she said, oh yeah, this is totally fine. She's like, you must be a tourist. You're not from around here, because this is just completely normal here. And I want to get back to that thought and how normal it is in Copenhagen to ride on a bike, even on a day when it's snowing, because that's at the core of what I'm talking about theoretically and what I think maybe we can do as a vision to make active transportation more common. Before I get back to her story in Copenhagen and beyond, I want to say a little bit about the public health field. And I love how health-oriented transportation is really seeking to improve community health and the health of the planet and public health in general. I think there's some things that I would like personally to hear more from the public health community. And one of them, of course, public health professionals do a great job of emphasizing how transportation relates to physical activity. And so I think we don't need to say too much about that. What I would love to hear more about is public health and safety and how important that is for people's lives. And in fact, we're going through right now one of the most disturbing trends that I've gone through in my career, which is the increase in pedestrian fatalities. The blue bars in this graph are showing that since 2009, we've had a 50% increase in annual pedestrian fatalities. The levels that we saw in 2018 were as high as they were in 1990. It's the highest in 3 decades. This is all at a time when motor vehicle safety basically has remained fairly steady. It's really been pedestrians in particular, and also bicyclists, who have had the most increases in fatalities. So I want to see the public health community be very, very much engaged in this concept about making it safer for these modes. Why is that? Some of it has to do with the increase in vehicle sizes on our roadways, and that's important to recognize, the size of the vehicle and the front end design. It's also the design of our roadways and communities. And we know for decades now that the most severe injuries are along major arterial roadways in urban and suburban environments. These are higher speed roadways. There's concentrations of crashes with this, which this map is showing, but there's also concentrations of the highest injuries and fatalities in these sorts of high speed corridors. We need to address those. Something very important to note too is that it's the impacts of these fatalities and pedestrian safety is not distributed evenly throughout our population. People of color are more likely to be killed as a pedestrian. This is something we need to remedy. As we talk about ideas and have a vision for a better transportation system, part of that vision should be creating a system that has zero fatalities, fatalities for nobody. How do we do that? Well, one of the ingredients to Vision Zero is creating communities that actually have more walking and biking opportunities, because those modes are actually associated with greater safety for everybody, including motor vehicle occupants. Why is that? They're associated with slower speed environments, and slower speeds are associated with less injury and fewer fatalities. Something else, public health, I would love to see emphasize even more is this idea of equity when it comes to transportation. And what is at the heart of equity? Well, in my mind, I think pedestrian travel is at the heart of this. The fundamental form of human movement is pedestrian travel. Everything else is an alternative, whether you get on a bike, whether you get on a bus, whether you get in a car, that's an alternative to your personal mobility. People's personal mobility may be in terms of walking, it may be in terms of being in a wheelchair or using some other assisted device, but this is the core of the type of transportation that a human has available to her or him. So we need to have places that are accessible to pedestrians of all ages and all abilities. If we've designed a place that is only accessible by car, or it feels uncomfortable to walk in because the distances are long, or you feel unsafe because of the streets, or because you feel unsafe or unsecure because of who you are, the color of your skin or your gender, these are things that are limiting you from experiencing what you should have as a fundamental right as a pedestrian. So we need to have our communities designed and be places where pedestrians are the core. So those few things said, I want to go back to Copenhagen and think about how do we ultimately get towards this world where active transportation really is something that's seen as an attractive option. When we look at Copenhagen surveys, they ask people, well, why do you choose to cycle? And the reasons are because it's easy, it's economical, it's convenient. These are things that make biking an option that is the most attractive for the situation at hand. Yes, exercise is important, eco-friendly is also important too, but those are some of the core reasons in terms of making biking attractive. The same occurs for walking for people. Now, in the United States, we have many communities that have said we have goals to increase walking and biking. Largest cities, most of states have published goals. And we have many cities and other agencies that have published complete streets policies. In fact, if you look at the last 10 years, the idea of complete streets, by the way, as it's been formulated so far, is really to design a street so there's space for all different modes of travel to use, whether people are walking, biking, taking transit, or traveling in a car. This is the growth in policies, especially over the last decade. You can see that many, many communities have taken this type of stand. But what we see when we look at the travel data at a national level, now this discounts the fact that there are a number of communities that are making lots of good progress, increasing walking and biking. But when we look at a national level, the big picture, between 2009 and 2017, there's basically no movement at all in terms of the share of trips made by walking and biking in this country. all during that time when these complete streets policies were enacted. Now, of course, it takes policies a while to have their effects, so that remains to be seen. But it begs the question, are we missing something else that we need to do to get more people walking and biking? And especially when we compare the US with other countries, now this slide is a few years old now, but the same trends apply in comparing us with a lot of the leading European countries for walking and biking. We are far behind. There's other places that have figured out how to create their environments that are welcoming for walking and biking to make those modes more attractive. If we ultimately want to get down to what is going to make us more likely to get people to walk and bike, we need to figure out how people actually think about these choices. Now, people are traveling from one place to another for transportation. That means they're going to an activity like work or the store or to visit friends or go to church. They're doing these things to take part in an activity at a certain place. So that means they have a certain level of time constraint to their lives, and they have choices potentially between various modes. And so it's not just simply saying, well, hey, everybody, just walk and bike. This is an option for you. It's like taking a pill. That's not the way to think about it. We need to frame walking and biking so that they are the most attractive option out of any other choice that people might have, especially versus taking a car if we ultimately want to make a shift. So that's what this particular theory that I'm highlighting here in this slide developed out of my dissertation work several years ago. This is what the theory tries to express. And the idea behind this theory is that it's trying to give practitioners some ways of thinking about organizing strategies to make the choice of walking or biking, and in some cases transit, more attractive than automobile. So it's framed as a choice. What type of transportation are you going to use for an everyday trip to one of those types of destinations? I mentioned work as an example. When you're going through the thought process, this is a framework that people will often go through. Now, there's a bunch of different ways that you could imagine people's thought processes to work, and this is one of them. There's other options out there in literature too, but this is one that I commonly think of. The first step is basically, are you aware of the mode that you have? Are walking and biking even options for you when you consider traveling out to the grocery store, for example? If you don't think of them, you're not going to use those modes. If you don't have a bicycle available to you, in other words, you don't own one, then you're not going to take those modes either. So awareness and availability are fundamental to this choice. Then the situational trade-offs in steps 2, 3, and 4 are really critical to why people will choose one particular mode over another when going from place to place. First one, a very basic need. You need to feel safe from automobile traffic. You don't want to get hit and injured. You need to feel secure from crime, have your own personal security when traveling. So if those things aren't met, you're probably not going to use a particular mode. The third one, convenience and cost. Well, if you have a choice between modes, use the one that takes the least amount of time, effort, or money. In places that have lots of walking going on, these are places where the trip distances are short. It takes relatively little time to go from one place to another for travel. In a lot of cases, automobile parking is either inconvenient, it's hard to find a spot near where you're trying to go to, or it's really expensive. The parking, you have to pay meters or pay several dollars an hour to park. So those are factors that influence whether or not you're going to make choose that particular mode. And then the fourth one, enjoyment. This gets into more broad personal preferences and social norms, or your care about the broader environment. In many cases, it's not the driving force of why somebody is ultimately going to take one mode over another to the store. It would take a very committed person to bicycling, for example, to ride their bicycle for 5 miles to the grocery store and then carry their groceries back. Now, that does happen. There are a few people who do that, but it's fairly uncommon. Most people will choose to drive because it's just that much more convenient, even if they do enjoy the activity of bicycling. So those are the key situational trade-offs. And then habit is ultimately what gets developed after you either go to the store or go to work multiple times using the same sort of travel, and you get used to it. You essentially don't have to think through the trade-offs anymore. You just make it automatic. For many people, especially in suburban environments throughout the United States, people just drive. They know that they can drive places. It's easy to do, and that's the only thing that they think of as transportation. Now, in places where there are more choices, the habits can be developed based on the situational trade-offs. Another really important piece of this theory is on the left side of the screen, the socioeconomic factors. This accounts for differences in individuals. Not every person is going to have the same preferences to do a certain mode. They're not all going to perceive the cost of parking in the same way. They're not all going to have the same experience with personal security out on the streets. This is where we get into differences by gender, by what people of color experience walking down the street versus people who are white. It's also where we see differences in people with disabilities. If you have to travel with a wheelchair, it may be much, much harder to be able to enjoy the same sort of walking experience. But in other cases, somebody in a wheelchair may also really enjoy their experience while traveling down the street, as long as there's well-developed curb cuts and excellent pedestrian crossings with accessible push buttons, for example. So, yeah, cultural acceptance, Sam just raised a quick question, would fall under the enjoyment category. So what I've experienced, and some of the survey respondents when I was doing this research talked about, is if your family or your friends say that biking is a great thing, or you really feel supported in doing that, that you'll be more likely to choose bicycling, for example. On the other hand, if your family says, hey, biking makes it seem like you're a poor person, you're a lower class society, and you get that cultural or social feedback, then you're not going to enjoy that mode as much. So that's where cultural factors play into this. So ultimately, when we look at these steps, how could we intervene in the system of transportation and land use that we have today? How can we intervene to make walking and biking be more attractive choices? Let's look at each of these steps along the way. One, if we want to increase awareness and availability, things like Bike to Work Week and Bike Month, Walk to School Day, individual marketing like smart trips. This is where people will go into neighborhoods, knock on doors of houses and say, hey, here's some options for you if you want to get a bike or take a bus route. Here's a map for you showing where that is. Some cities have offered these types of individual marketing programs to people who've newly moved into a place, because that's when they're first formulating some of their choices and developing their habits for transportation. Availability, of course, having bike sharing as an option. Bubbler Bikes here in Milwaukee is a good example. Other types of shared mobility and micromobility give options to people who may not want to or be able to own bicycles or other ways of getting around. For basic safety and security, we look at things like the street environment and how comfortable it is for people walking and biking to be around traffic. Places like multi-lane streets that are higher speed are not comfortable places for people to walk. People feel unsafe from traffic. Why is that? One of the key reasons I mentioned before was design speed. And this graphic is a great way to show it. Your focus as a driver when you're traveling down the street becomes much tighter, and you can see less of the area on the periphery of the street if you're going at a faster speed. And also when you're going at a faster speed, beyond being not able to detect pedestrians or bicyclists as easily, you're going faster, so it's harder to stop quickly when you may be confronted with somebody. So this again leads to more severe injuries. This is why we see a number of cities around the country that have started to adopt and allow 20-mile-an-hour speed limits on residential streets, or on the main street in Boulder, Colorado. That's where that one on the right is from. This creates a safer environment and a place where people actually feel that walking and biking are more attractive because that safety factor. Complete streets strategies also address safety, and there's a variety of these that I'm not going to get into the details of, but some main categories are reconfiguring roadways when roadways repaved or reconstructed altogether, adding designated space for bicycling, adding safer crossings to reduce the potential for motorists to strike pedestrians in crosswalks. But it also doesn't have to be at times when a roadway is completely reconstructed. There can be short-term quick fixes. This new curb extension added here with flexible delineator posts in DC is an example. We're doing this in Milwaukee now. Our Department of Public Works has done some on North 27th Street, and looking for other opportunities to add quick improvements that are going to make a difference for safety. When we look at residential streets, neighborhood greenways, which you guys have in Madison, we're just starting to develop here in Milwaukee, sometimes called bicycle boulevards. These are ways of making residential streets feel safer to bicyclists and to pedestrians. There's a lot of different configurations that can be developed, but we've been very successful in many cities. Put together, as we reconstruct roadways with separated bike facilities, neighborhood greenways, we create a low-stress pedestrian and bicycle network, allowing people to connect in all parts of the community with something, and this is the main point, that they're going to feel safer while they're using. So we can make public space more multimodal, and guidelines from the National Association of City Transportation Officials are great to look at for doing this. But we can also think about car-free streets. Copenhagen has some examples. Places have, in North America, have started to adopt this idea after New York closed down Broadway near Times Square, and several other types of open streets improvements. And we call them open streets because they're open to people and not just to cars. One of the most important strategies, set of strategies, is related to convenience and cost. And as I was alluding to before, these complete streets idea and making a network for walking and biking be safe just doesn't get us all the way there. Convenience and cost is incredibly important to get people to make walking and biking routine choices. Mixed use infill development can help create that sort of convenience. In this case, the Whole Foods market is down below many residences, and so people just have a short trip out on the sidewalk. They can go into the grocery store. There's many people living in condos nearby who can, within one block, walk to this. We have this sort of development going on in Milwaukee. It's in smaller cities like La Crosse, apartments above an Associated Bank and other retail stores. Mixed uses shorten those trip distances and make walking more convenient. They also make biking more convenient because a shorter trip distance is a shorter trip time. When you combine that mixed use development with good high quality rapid transit like BRT, we can see people having an opportunity to walk and bike in their own neighborhood and also make longer distance trips by public transit. And this gives people a good choice not to own a car, or at least not to feel like they have to own a car to participate in the routine trips of their life. I love to give the example of Hilldale Mall. Those of you in Madison know very well where that is. When I was growing up in Verona, for my first 18 years, when I would go to Hilldale Mall, it was a parking lot on the side of Midvale Boulevard. And so the gray polygon shape that I've got there was just a parking lot. But 10 or 15 years ago, they redeveloped that parking lot into more retail space, more residential condos near there. And now we have people able to live a little bit closer to where that shopping is. And plus, people who are walking from the nearby neighborhoods don't have to cross through a parking lot to get to the shopping center anymore. And you create a street that has a much more convenient situation, and it's also feels more comfortable for pedestrians in that area. If we have places that support walking and biking, and we've designed them in this way, it's possible to also have more expensive automobile parking. And in some cases, the automobile parking, because its supply is limited, needs to be much more expensive. Because for the people who still do need to drive to take part in activities in this type of location, they end up paying more. This makes it so that if you're choosing, downtown Manhattan to either drive or take the subway, and you see that 1 hour of parking is costing you almost $15, that makes this choice very real for you. Is it worth it for me to spend $15 to park? Well, no, I can take the subway for much cheaper than that, or I could walk or take my bike. So expensive parking does go along with walking and promoting walking and biking. But something that's important to be careful about is that we can't just say, well, we're going to get rid of parking and make it really expensive everywhere. We've got to make sure that people have other options to also get around that are attractive and safe and enjoyable. So that's where all the steps of the theory need to work together. In terms of enjoyment, things that we can advertise: personal, social, environmental benefits, helping to make people aware of those. Those are my parents at the state capitol, by the way. And that's going to help change social norms and make attitudes more accepting of people who are walking and biking. When you go to an outing in Portland, Oregon, people will ask you, "Oh, well, did you bike here?" And yes, you say, "Of course I did." If you say, "Oh, I drove," you really apologize for that, because they have that sort of social norms there. And that's not the same case all around the country. We know that people do enjoy, for the most part, walking and biking. People make many walking and biking trips recreationally, but often people, when they do that, they're going to places where they feel very safe, or it's an enjoyable environment to be walking or biking in. And they have lots of time on their hands to do that. They take the time out of their Saturday to enjoy a bike ride, or when you have excess time. And so, but that's not meeting our travel needs when we need to get from place to place. On the other hand, we can take advantage of this idea of enjoyment when people do start to use their previous experience enjoying walking and biking and then do it for commuting. An example from our campus travel survey a couple of years ago, we asked people to compare the enjoyment they had on their previous commutes prior to coming to UWM versus what their current commute to UWM is. And so the people who reported that they were increasing their satisfaction, first of all, most people who had a shorter commute distance, they were more likely to report that they enjoyed their commute. But the other big trend we saw was that when people shifted from driving a car in their previous commute to walking or biking to UWM, they actually increased their satisfaction. So there's something about the experience itself of walking and biking that can be beneficial. If you can just get people to start doing it, then they'll probably do it more. And that brings us to the idea of habit as well. People are going to use that mode that they are used to using. And so how can we break habits? Well, first of all, starting early, Safe Routes to School is a way to help get kids and the parents of kids thinking about walking and biking to school as options. But there's also other times, if gas prices spike, people often think, oh, should I be driving to work as much? Should I drive my car as much? Maybe I could look for something else as an option. People might change neighborhoods or change jobs at those times. Telling them about walking, biking, taking the bus as combinations of ways of serving their needs. That is how to intervene at a particular targeted time. And of course, here in Wisconsin in particular, when spring happens, and that's a natural time for people to want to get back outside and be active. So that was a lot of how we could potentially increase walking and biking through these steps. But it's important to reflect on the system that we have and how, when we think of those 5 steps, what an amazing job we have done as a society over 50 plus years to make driving the most competitive travel choice. We built freeway systems to reduce the travel time and to really make automobile travel very safe. We have very clear design guidelines for our automobile modes to use these high-speed roadways. We've even taken that idea and translated it into surface streets in many suburbs and cities where we widened them out so people could drive cars easily. Now, this had, of course, a detrimental effect on the ability for somebody to walk across this type of street or to bicycle along it, but it was an amazing job of making it really convenient and really safe to, safe for the most part, except for high speeds, to drive a car. Or people often will perceive this as very safe. We also built suburban tracts of housing that are not close to shops and they're not close to other types of work or other activities. You can't walk easily to do your errands in a place like this. And the places where the shopping and other activities are often surrounded by large parking lots. And so, yes, you do have a convenient place to drive your car, but it is really hard, feels unsafe, and it takes a long time to walk across this parking lot to get to the Walgreens store. And so automobile is the most competitive choice. Walking and biking are not competitive choices in this sort of environment. And the big challenge that we have is that much of our urban environments, or much of our development around the country, is in places that are conducive to automobile travel, but we've pretty much designed out the idea of walking or biking. There are exceptions, of course, in some suburbs and some small town areas, but we can see how much of the US population lives in places where most likely it's not convenient to walk or bike. So what do we do about this? How are we going to overcome this and change how people travel so we're more active and so it's better for the planet? Well, we have to reimagine, first of all, and we have to spend lots of time and effort. So this is a multi-decade problem. We do have some good examples where progress is being made. So if we look at this, what are some communities where all these steps are being met? One example is when I, a couple of years ago, looked at the top census tracts in the country. So these are all neighborhood level areas where people are bicycle commuting on. You can see the top one near Stanford University, 52% of the commuters, the workers. When we look at the top 100 tracts, if you average out that commute mode share for the top 100, and this accounts for more than 200,000 workers, 21% of those 21% of the people in those top tracts bicycle. So we're getting to levels of like a Copenhagen, where they have, of course, 36 or so percent of their commuters biking. But you know, if you take certain portions, certain key neighborhoods in the US, you see these high levels. What are they like? Well, they're places that have good weather, not surprisingly, but close to university and college campuses, and places that are also in dense neighborhoods close to central business districts. Those are places that have the characteristics of convenience in many cases. Certainly greater bicycle facility density, we found that as being a factor that was important. So it's, people felt safe, probably safer when they had those facilities out there, but higher population density, being closer to the campus, that is a convenience factor. And hopefully the direction of the arrows is that those environments were created so that people were consciously making the choice to be able to live without an automobile. It's not as good if we have the opposite situation where people who may not feel like they have the resources for an automobile are then stuck in a type of place where they can't get around very efficiently. So hopefully we have the environments that support living without an automobile and make that an attractive option. Last example that I'm going to give is not one of the most famous examples like Portland or Davis or Boulder, bike-friendly communities, but it's actually Washington, D.C. I lived in D.C. for 6 years back in 2001 to 2007. And it's actually a little bit hard to recognize DC in terms of the changes that they've made in that city. And they've made changes that make walking and biking much more attractive. So they've added some of these short-term type improvements to make pedestrian crossings safer. They've done an excellent job of building a low-stress network, many separated bike lanes through various parts of the city. It's not by any means complete throughout the entire District of Columbia, but they're really building their network. They have a capital bike share system that they support publicly. They also have the shared mobility of shared bikes and scooters. And their parking is limited. When they put in new developments, there is not a huge surface parking lot that goes along with them. The parking lots that are included underneath them are very limited. The parking is expensive, but because this is done and planned out together, there are other options that are also attractive. So people don't necessarily have to pay parking prices for the most part if they have good other options. The metro system throughout the city is one of the really great examples of transit around the country. They've added a streetcar system, and so people have these other choices. But I think one of the most overlooked things about DC is how much development has occurred there in places that are walkable and bikeable. So while you've got the development of the low stress networks, you've also got new types of higher density condo buildings going in, mixed use, so that people are living in environments where it's easy to do their daily needs by walking and biking. The giant food store here is located right below condos, so very convenient. It's not surrounded by a large parking lot. Walmart, even Walmart does not have a parking lot just north of the Capitol in Washington, D.C. These things are possible. And so you see the results that have happened even just in 8-year period. DC has added 73,000 or so more workers during this period. During that time, the automobile mode share went down slightly. Walking and biking increased. And when you look at the percentage mode shares, the bicycle mode share doubled. Still it's only 4.5%, but it doubled bicycling. So we see a mode shift there. I think the most impressive statistic that I've been able to come up with is that of those 73,000 workers, when they're added to the commuters that were already there, 21,000 of those new workers commuted by automobile, but 23,000 of them commuted by walking or bicycle. So you're seeing a real shift in the new people that come in and are taking those job opportunities there. So it is possible. And I'll end with this. We have some really good traditional strategies that have been used to increase walking and biking and make them more attractive. And, adding facilities and the complete streets type efforts are really important. We still definitely need to do them. We also need to encourage people to walk and bicycle more. But I think we need to add some additional strategies, targeting positive messages about walking and biking at particular times when people change jobs, when they change neighborhoods, when the spring starts. We need to think about opportunities for pricing when it makes sense when people have other options. We can make automobile travel more expensive and a little bit more difficult. And then land use patterns. In the long term, we need to be developing patterns that support walking and biking, but walking in particular, that needs to be a convenient option for everybody. And so with that, I'll end and take questions that you may have. Yeah, I saw one from Sam just a second ago. You said something about the UC Davis campus. And yes, quick story about that. I did postdoc work there. And so they don't allow vehicles on campus. And the basically the campus streets are used for mostly bicycles, also for pedestrians. Internal to the campus, it's only delivery vehicles that are allowed in certain cases at certain times of day. And so their bike commute share to campus is 46%, at least in one of the most recent travel surveys that I saw. And so, and Davis, the community itself, you saw had 3 out of the top 5 or 3 out of the top 10 tracks in the country. And so they've really embraced this idea of making biking convenient. And just also a small anecdote, they built a parking garage on the edge of campus in the early 2000s. And when that happened, they had a decrease in their bicycle commute mode share, and they saw bicycle commuting actually go down slightly in the city of Davis. I saw a question from Robbie, I think, or you had your hand up.
Yeah,
Yeah, go ahead.
I was just going to sort of throw in that I mean, Madison's a great place to bike and it's far ahead of many places, but one of the battles that we're still fighting is prioritizing driving and car storage in the public right of way as the default. So we can't put another street traffic light in for pedestrians to cross because that would reduce the level of service for driving. We can't remove parking to put in a protected bike lane because we have to have a place for people to park on the street. And I think that whole mindset, that whole policy assumption that we have to make sure that driving and storing your car is relatively simple has to change.
Absolutely. Now, it obviously is going to make driving very convenient when we make those sorts of choices. If we want to make walking and biking more convenient, we're actually, by making driving so convenient and making parking so common and dedicating the spaces in our right of way or even in private spaces where there's large parking lots, we need to realize that that is making it less convenient to walk and bike, and it's making the trade-off that much more difficult to favor walking and biking. Now, I emphasize again, though, we have to have the supporting land uses to go along with the idea of reducing parking opportunities. Because if we try to limit parking and make it more expensive or replace it by protected bike lanes in places that are really inconvenient to walk and bicycle, then we're creating a problem where that many people are going to use the new infrastructure that we've provided or we've tried to provide for walking and biking. It's all got to kind of go together to give people good options.
I completely agree. I just wanted to sort of throw in that we're still fighting the battle even where we do have excellent other choices.
Even in Madison. Right?
Yeah, we're still fighting that battle to take back the right of way for human powered transportation.
Yeah. And that's where we get into the idea of standards, design guidelines, some of which are written into ordinances in terms of parking and subdivisions, or it's sort of perpetuated by the profession, where the planners and engineers who are making the choices are assuming that this is what people want. They're making a choice to say, okay, we generally that people want to be able to drive their car fast and have as little delay as possible. And so that's why we use level of service as a measure of our transportation options on this street. When planners and engineers are doing that, they're substituting this assumption of what people want for the idea of actually asking them what they might want. I have a question from Sam here about speculating on the effects of COVID-19. Sam, do you want to just ask that, so that I'm not sure if everybody saw it?
Yeah, sure. I feel, I know it's just pure speculation on your part, but I think it's an interesting thing to discuss briefly about how COVID-19 is going to affect the mode share. I mean, initially there's been an increase in cycling, but long term, do you have any insight or just?
I've got so many guesses, but yeah, it's
a question about autonomous vehicles. So
yes.
I remind everybody that was on the horizon as well. So anything you have to say would be
for sure. I think so. If we go back to the theory and think about, let's see if I've got this. I don't know. I'll think about the steps. People in particular right now, when it comes to transit, thinking about being on a bus with other people, being on a subway with other people, are not excited about that idea because they're worried about their personal security, personal safety, basically. I could get sick. And so that is changing that mode for sure. We've seen decreases of more than 50% on transit systems across the country. And so it's going to take some major change in either how people are perceiving the virus or the virus to go away for that aspect of transit to change. Now, because of the shift from transit, people are looking for other options. And I think walking and biking have actually taken some of that shift from transit in cities where these are really viable options. The other thing that's happened with COVID, I think, is people are making different kinds of trips than they did before. So a lot of people, unfortunately, are out of work. Other people are not commuting to an office. So now they're spending time in their house and in their own neighborhood, and they have an opportunity to sort of want to get, or they have a desire to want to get out. And so walking and biking are really convenient opportunities to do that simply for recreation, to get out. And because if you're just doing your trips within your neighborhood, you're also making shorter trips. Let's say if you commuted 10 miles to your workplace before, you'd often do a lot of your errands on the way back home, your trip chaining. But now if you're just basically located out of your house, you're going to be able to do a lot more of your trips locally. And if at least you're in somewhat of a walkable and bikeable place, those are going to be convenient to do. And the other piece, of course, is the recreational side, and people having fewer opportunities to go to the gym means that they're looking for other opportunities to recreate. And we've seen increases on the trails of 50 to 100%, at least in our region. I'm sure the same is true around Madison and other places. So will these shifts continue? I don't know. And one other thing on this, since it's such a great question, what does it mean in terms of people's habits? So we've gone through this really big transition in people's lives that's essentially broken whatever they've been used to, at least for a little while. So they've had an opportunity to actually experience their neighborhoods in ways they probably haven't before when they were commuting in the way they had previously done. Now they're experiencing it differently, so they can rethink options for walking and biking. The other thing is that cities that have taken the time, made the effort to create active streets, essentially, or open streets, close down certain streets, residential streets to cars, and allow people to walk and bike on them, they're seeing that public space can be used differently. And then some cities that have allowed restaurants to expand their seating out into the street and to take automobile parking spaces and use them instead for those either retail or restaurant purposes, are now realizing that space can actually be used differently. So we're seeing a chance to potentially reevaluate our habits, not only personally, but also in how we as a community dedicates its public space. So in some ways, I'm hopeful from this that we can see those new opportunities.
We have a question here from James Hannig. James, if you can unmute yourself and go ahead and ask the question. But then this will be the last. We have to wrap up. We're almost at 5 o'clock here.
Sure. Hi, Bob. Awesome presentation. This is probably a big one to end on, so feel free to tackle it as you want. So how do you feel, kind of similar to the COVID-19 question, do you feel the new focus on racial equity may change urban mobility and people's behaviors?
It's such an important question, and when I was alluding to this before when I was talking about the socioeconomic side, and you know that the word socioeconomic is encompassing a lot of different things, and so it's people's perception of who they are in public space and other people's perception of who they are. So it's getting into race and gender issues. And as we think about that, I think unfortunately, it's been a revelation. It's a very fortunate revelation. It's unfortunate that it's taken so long for many of us in the profession to really recognize the differences in how people experience the streets. That is, how does a person of color experience going down the street if they're thinking about how a police officer may look at them, or if they're concerned about how some other member of the community might worry that they're representing a risk of crime or something like that. And so we as a profession, I think, really need to be thinking more about how the social space of streets is being experienced by people, not just the physical design of the street for certain modes, in terms of providing space for bicycles and providing enough space and safe crossings for people walking. But we also need to figure out ways that the social space of the street is going to be welcoming to all. People of all colors, people of all genders, people of all abilities. And doing that is going to take us a lot of work. I'm working with Carrie McAndrews. She's the lead investigator on a project where we're investigating complete streets and thinking about it from this perspective. And so we'll have more work coming from this. We definitely want to engage the city of Milwaukee and James, you and your team there in thinking about this. You know, how can we create these spaces to be more welcoming? Does it have to do with yes, can physical design help us? Or how can we engage other types of leaders in the community? How can we engage with law enforcement to make these places that are welcoming? And so I don't have answers yet, but I think that this is a conversation that we are having and need to have now.
Well, thank you, Bob. I think this is a good place to stop. It's 5 o'clock now. Just want to thank you again for your talk. It was very interesting. Appreciate it.
Well, thanks again for having me. I really appreciate it, and thanks for the questions, everybody. It's fun to discuss. I think we can do a lot in the coming years.
Great. Unless there's anything else, I guess I'll press the red button and end meeting.
Well, let's sign off and say thank you so much for hosting, and thanks, Bob, for being here and joining us and sharing your work.
Can I ask when the recording will be available and how?
Yes, you can ask. I don't have an answer. I guess just generally on the website is the answer.
Will you send us an email when it's ready? Because I'd like to pass this on to some people.
Yes, I will make an announcement when it's available.
Okay.
Thanks for the question. Yeah, that's a good reminder.
Thanks.
Okay, thanks again, everybody.
Bye.
All right, thanks.
Thank you.
Thank you.